Thank you for joining us. I'm Susannah Schaefer, and I'm honored to serve as Smile Train's president and CEO. Thank you all for so generously supporting Smile Train's work as members of our Premier Circle. And thank you for generously sharing your time with us today. Now, as you may know, this year marks a big milestone. 2024 is Smile Train's 25th anniversary year. Over the past 25 years, we have grown as an organization, extended our reach and impact around the world, expanded the breadth of care and services we support, and pioneered a range of groundbreaking innovations. All of this brought us to another extraordinary milestone. Now, I'm thrilled and very, very proud to share that Smile Train recently supported our 2 millionth life-changing surgery. Not only is that more than every other charity combined, it's not even close. Of course, 2 million surgeries is much more than a statistic. These are lives changed, and in many cases, saved. And with each patient we help treat, we are also serving a family and indeed a whole community. The focus of our discussion today, education and training, has been at the heart of our success from the beginning. Our main founding principle, our teach a person to fish model, has always centered local empowerment through education and training, and the results speak for themselves. From a small charity founded on a belief that things could be done differently and more effectively, we have grown into the world's largest Cleft organization. In just 25 years, we've supported life-changing Cleft surgeries in more than 95 countries across 5 continents. We've offered more than 100,000 training opportunities around the world. We've trained more than 20,000 medical professionals, including surgeons, anesthesiologists, orthodontists, nutritionists, and speech therapists around the world. Our work equips generations of medical professionals all over the globe with the skills and abilities to care for the communities in which they live, now and well into the future. Now, without further ado, I would like to introduce our incredible panel. Today, we will hear from Smile Train's Director of Program Safety, Dr. Elizabeth Igaga, Smile Train's Medical Advisory Board member, Dr. Roberto Flores, and CEO of the Bela Foundation, a long-standing Smile Train partner, Dr. Martin Kamau. Dr. Igaga, I would like you to take it from here. Thank you.
Thank you, Susie. And it's an honor to moderate this panel of experts and I think that we're going to have a very nice few minutes, unfortunately, together. So first, I'd love if our panelists could provide a bit of information to help us understand the global context of cleft care. And I'll start with you, Dr. Flores. Could you help us understand what a cleft is and what associated health issues may exist with patients with cleft?
Sure, thank you. For what a cleft is, and I actually don't like the actually term cleft lip because it's much more than a separation of a lip. It can be a separation of the face, the gum, the lip, the gums behind it, and then also the palate all the way to the back. So it's actually a cleft of the face, like a separation. And in separating all those parts, you're actually affecting different functions of the face. That is, one, the most obvious being the appearance. 2 is nutrition, being able to eat appropriately, even something as simple as suctioning during the first months to a year of life is really not possible to do normally when you have a cleft in the palate. There is speech aspects, and there are aspects with the way the ears work that are associated with patients who are affected with a cleft palate. Also, facial growth also can be affected through the procedures, the necessary procedures that are done. So it is really a multi-organ system that is affected. And in fact, comprehensive cleft care requires more than one surgery usually requires several procedures over the course of a child's development, and then also the integrated utilization of other specialists, such as feeding specialists, speech specialists, dental specialists, and oral maxillofacial specialists.
Thank you, Dr. Flores. And I believe, as we can all see, management of the patient with cleft is a multidisciplinary task. And I'll move over to Dr. Kamau. You have been a long-standing partner with SmileTrain. Could you speak a little bit about your experience and what is the importance of the SmileTrain network collaboration, and how does SmileTrain help to solve issues around gaps in care, such as lack of funding and trained professionals?
All right, thank you so much, Elizabeth. Yeah, so I'll say this, I've seen kind of the whole gambit. Coming from a developing nation, our healthcare system is not as robust. So when I'll just take you back in my history, when I finished my residency around that time, maybe around 2010, SmileTrain was actually coming into our country. It was just getting established in Kenya. Before that, the treatment of cleft was really mission-based, and it was really, when you talk about mission-based, is where you have maybe some medical practitioners coming in, they operate maybe for 1 week and leave. And so there were great gaps that came about. Now, as SmileTrain came in, they came in with that new model that was, teach a man to fish. And so they empowered us to come to be able to give the local care. So over the past, 15 or so years, we've seen the development and really the change in how we've been approaching our patients. From just that approach of where we just maybe used to see patients maybe twice or thrice a year in the mission-based model, and now that we could now see them every day, we're able now to incorporate that what is important in terms of the comprehensive kind of cleft treatment. So over the years, really SmileTrain, its model of care has enabled us to be able to give better care for our patients, really from what we used to have before.
Thank you, Dr. Kamau. And both of you really give generously of your time as surgical trainers, as surgeons with cleft, and as experts in teaching some of the people in the field. Dr. Flores, could you speak a little bit about the evolution of education and training for cleft surgeons and the role that SmileTrain has played in this evolution?
Well, SmileTrain, interestingly so, has had a leading role in leveraging innovation and in particular technology for the training of cleft. The founder, Dr. Charles Wong, as his business fortune was based on leveraging technology, and from the beginning, SmileTrain has very thoughtfully implemented technology as part of their training resources that they provide for zero cost to surgeons throughout the world. I was initially brought in during this process. It started with a partnership with Cord Cutting, who is one of my mentors. And at the time, Dr. Cutting and SmileTrain created these DVDs. Remember those, for those of us who are a little bit older, these DVDs that demonstrated the cardinal procedures of cleft care, and a digital representation of the procedure itself, with also intraoperative video as part of the DVD package. And these were free DVD textbooks that were distributed for free throughout the world. And at the time, it was a huge innovation. And then from there, at seemingly the perfect times, SmileTrain was then using that foundational type of digital technology to then distribute through the internet. Once the whole use of the web, which right now it's so funny to say so now, but back then it was something still relatively new, and creating a website platform where somebody can go in, log on, and use a virtual three-dimensional textbook that was interactive, that was available in 5 languages, that showed the cardinal procedures of cleft care. And then after that time, they transitioned to phone-based technologies such as iPhones and Android phones. And in fact, for those of us who travel, you can go into a developing part of the world, an underserved area, and many people have phones. What is actually more difficult to obtain in the developing world is a textbook. And what we already know is we can provide a much better surgical resource with regards to learning how to do these procedures through using digital technology versus a textbook where you just have a flat drawing. And then finally, we're transitioning right now into the VR space. And this is something that I will hopefully talk to you about more later in this virtual presentation.
Thank you, Dr. Flores. I have had the opportunity to be in the same operating room with someone in the US, me in Uganda, and someone else in Europe through virtual reality. So looking forward to hearing what you have to say about that. Dr. Kamau, could you please speak to the advancements in medical technology that have improved diagnosis and treatment of cleft lip and palate in Kenya and across the African continent?
Okay, so I'll speak a little bit of my own experience, and I'll touch on something that Dr. Flores mentioned. Those little DVDs that he mentioned, those were crucial. I remember actually going through each of those DVDs and going through cord cuttings techniques and all those, the debel. It was amazing what you could do, because when somebody reads a textbook, it's really difficult to try and visualize. But when you see those DVDs, it was kind of revolutionary. And for us who are back in here in Kenya, where we cannot maybe access those better kind of education tools, it was very important. So as we've advanced, I think technology has been the greatest equalizer. And again, using that DVD notion, now we can be watching, like, for example, Smelton has now been rolling out digital solutions, whether it comes to virtual surgery simulations, or even actually using 3D printed models. For us in Kenya or in Sub-Saharan Africa, it makes it so much easier to learn. We can sit in a webinar, but when you have that experience, when you look at that model, the 3D printed model, and you work on it, you're not practicing on a patient. You're actually working on a model first. And so for me as a trainer, I can be able to train somebody who will practice on the model and not on the patient. So one of the key things that it does is also improve really the surgical outcomes, all right? Because you're not practicing on the patient, you will not get poor outcomes. So those are part of the key things that have advanced. For us, we also keep on learning. So whenever we have these digital solutions and we're seeing them every day, we're also learning. So it has been wonderful. And I think the key advances are the digital. So they've bridged the divide of what we are learning, because now I don't need to be in the US or in Europe to see. I can actually be seated here in Nairobi, Kenya, and actually see something that is close to reality. And those are the key things that I've learned, and at least SmileTrain has really been important for us.
I think that this innovation is just going to continue to blow us away. While we continue to think about that, I would like to bring our attention to the SmileTrain partnership model. It's already been spoken about, teach a man to fish, but it basically ensures that ongoing care is available to patients in their own communities, and it provides comprehensive cleft care treatments that prepare patients for surgery and provide essential post-surgical care. Back to you, Dr. Kamau. You are a long-time SmileTrain partner, and I would like for you to share some information about how you have seen comprehensive cleft care programs grow to provide essential care alongside the surgery that you and other SmileTrain affiliated surgeons are performing around the world, and speak about how unique each patient's clinical pathway or timeline is.
That's a lot. That's a very good question. Again, I'll just take you back just for the history. Because of how our healthcare system has been, there's been a very rapid evolution in terms of how our care is. Not only in cleft, but in general, healthcare or surgical care. Specifically talking about cleft, I told you most of the things that we used to do, most of the treatment modalities that we used to do around cleft were based on the mission model, which yes, sorted out the primary issue of the cleft lip, the aesthetic problem, and with the cleft palate, but did not address everything else. I mean, for us surgeons, we probably thought, or healthcare professionals, we thought that this was adequate. We were treating the condition, but we were not treating the patient. So when SmileTrain came in with the teacher man to fish a model, because now we're on the ground, it's not a model of where you bring in people or surgical specialties and then for 1 week you operate and they leave and you're kind of left for maybe 6 months. Now, because now we are empowered, and that was very important. It's a very important thing to remember. We're empowered locally to be able to carry out the surgeries. The empowerment is through the funding and the training opportunities that were given. So now you're with the patient in your home hospital and you're with them every day. So now the comprehensive care just naturally comes in because the patient will come and tell you, yes, you repaired my cleft lip, my cleft palate is okay, but now I can't, my speech is poor. What about my dentition? So as a natural evolution from that model of care is where you can now see the comprehensive cleft care coming into being. And so we've kind of grown together with SmileTrain as also they've been now really focusing and implementing comprehensive cleft care together with safety and quality. We've grown together. And so even if we are to come now to Kenya and areas in sub-Saharan Africa, we are now having these areas where we're actually developing comprehensive cleft care centers where we're trying to put in our specialists. So we're still a little bit behind what is happening in the developed world, the US, Europe, or the Far East, but at least we're catching up and we're not taking too long, right? So we're actually moving in leaps and bounds. And that's one of the most, I think, outstanding things that we've had with our partnerships with SmileTrain.
Thank you, Dr. Kamau. Growth is always a good thing for us to see. And Dr. Flores, through your eyes, please tell us about how you think technology is improving the quality of comprehensive care.
Thank you. I think there are two ways. One is in terms of training, and the other part is in quality assurance. As Susie mentioned earlier, the SmileTrain celebrated its 2 millionth surgical procedure, but it's definitely not about the numbers. It's really about quality. So on one hand, we as an organization are able to vet and in fact grade the great work that's done by our partners throughout the world. And every once in a while, we'll identify an opportunity in which we can help a partner really improve their technique and improve the quality of care. So not only are we as an organization supporting the care, but I think we are also being responsible shepherds of this type of opportunity by also ensuring that our quality is really at the highest level possible. And these surgeries are anonymously graded by a group of experts. I am one of the people who contribute my time for this type of work. So there's the quality aspect, and then there is providing the training resources. And I would say that a big part of it is technological through incredible models such as the Simular model, which SmileTrain acquired several years ago, leveraging the simulation environments that I just mentioned. But then the other part is just supporting other partners in their participation in educational opportunities. I was just in Milan yesterday. I actually just landed yesterday evening from the European Cleft Craniofacial Association. I saw several SmileTrain partners there, actually not only learning at the conference, but they themselves showing their great work, at the podium and teaching others. And I think that their participation in a meeting such as this is a continental meeting, where they are not only learning but also leading the charge, is something that would not be possible without the support of SmileTrain.
Wow, thank you, Dr. Flores. I'd like to think that we all agree that the future is bright for children born with cleft lip and palate, thanks to leadership from experts such as yourselves and to SmileTrain support. So I'd like to lean into the future just a bit. Dr. Kamau, what would you like to see the future of cleft care in Kenya look like in 5, 10, 25, and 50 years?
Okay. Good question. We're a global village now. The internet has opened the world to us. For me, I think for cleft care, we just need to optimize. Whatever would like to be like where Dr. Flores is in New York. We need to optimize the care we give. If we have a comprehensive cleft care center, we need to optimize everything we're doing. I'll be frank, we're not yet there, but we're on the way. But we need to really optimize so that we can give the quality of care that our patients deserve. All right. So we're getting there. So that is kind of, maybe I would think of it in terms of a short-term outlook. And of course, in the future, that maybe is 5 to 10 years. So we need to optimize what we're doing. And that's basically not only in Kenya, but in sub-Saharan Africa, or should I say in developing countries. When I'm looking about the future, we are now thinking about sustainability. How can we keep our center sustainable? Our patients are poor. Our governments, the police, the health systems here are a little bit weaker than what you'd get in a developed country. So we want to see sustainable solutions where we have now partners like Smeltron who come in. We hope that in the future there'll be more of the quality assurance training aspect, but now in terms of the finance and making sure everything is sustainable, we need to have a sustainable model that is carried by us. It has to be us carrying that part of that load. And so the onus is on us. So for me, the future obviously will be composite. It's kind of all together. We still need developed world in terms of the advancements they're doing, all the research will be critical. We need to optimize and we need to have a sustainable solution so that the care we give, our patients are very poor. So we need, the funding aspect is crucial. So that, I think, is something that I'm thinking about our future in terms of, in Kenya, the sustainability aspect in the 10, 20, 30, 40 years to come. Yeah.
Thank you, Dr. Kamau. I'm hearing optimization, sustainability, and collaboration. Dr. Flores, what does the future of education and training look like in cleft care?
Thank you. So as I mentioned before, virtual reality is the next step, and we are right now in the process of developing this technology. We have our first VR simulations already completed. And I know maybe some people might think, wait a minute, that sounds pretty expensive. How do we now in 2024 implement this globally? And I would say that I'll repeat something I said before. Smile Train has been very thoughtful about when we implement technology. When we started doing the DVDs, they were naysayers. And yet it did change the world because I said, well, not everyone has a computer, not everyone can, utilize this. But in fact, you don't want to go where the ball is. You want to go where the ball is going. And the same thing happened with the internet. And in fact, those of us who were, many years ago, we would find even in remote areas of the world, internet cafes. And in most hospital systems, they have internet capabilities. So yes, they were able to log on to the World Wide Web and access our simulators for free. When we made the next transition to cellular phones, again, people thought, wait a minute, in the developing world, people do have cell phones? Yes, they do. And it's going to become more and more accessible. And right where we are in 2024, it is, of course, it's not ubiquitous, but in terms of our partners, the people who need need these resources in their hands, they do have access. So 2024 VR, where are we now? Right now, a HoloLens, which is one of the most commonly used VR headsets, is cheaper than a cell phone. So we have hit a major inflection point whereby this technology is going to be really widely available. And in fact, Smile Train has deployed these HoloLenses into the hospitals of their critical partners, including the Cleft leadership centers. My vision and Smile Train's vision of teaching is one in which we no longer have to depend on flying people around the country and around the world to go to, let's say, conferences to learn. And in fact, we can create virtual classrooms, virtual operating rooms in a completely immersive world of VR, connecting New York to Nigeria, San Francisco to Senegal, bringing everyone together, and we can perform the procedure together We can ask, why are you doing it this way? Everyone has the surgeon's view, and we can repeat the procedure over and over and over again in a safe environment. And this is our vision for education in the future.
Thank you, Dr. Flores. I think what I've picked is we don't want to go where the ball is, we want to go where the ball is going. And I think that Smile Train is doing that in quite an impressive manner. Thank you so much, both of you, for the work that you do. And we know that the work that we do does not leave us the same. So Dr. Flores, I'll start with you. Could you share a story of maybe a patient or an experience with your cleft care that has not left you the same?
So these are three very meaningful pictures. I was asked to provide photos, and I will start with the center one, which is really care and teaching. Both of the people assisting me in the procedure are going to be destined leaders in cleft care. The person with the glasses on the left is my now graduating craniofacial fellow. She went to medical school in Colombia, in Medellin, and by working very hard and sacrificing a lot, she was able to obtain a plastic surgery position as a resident at the University of Pittsburgh. I chose her as my research fellow, and she will be faculty at the University of Pittsburgh as a cleft and craniofacial surgeon and working at our children's hospital. And she has every intention to help out in whatever way possible to her country, because and she realized that there's a lot of need for experts there to help. And then flanking the photos to the right, the ones that are in color, are actually patients of mine that I have treated. And this happens to be at a gala event, and where many of our patients go. And one of the things that I really love about the photos, especially the one on your left, is you see the energy. You see that when someone feels restored, and their feel comfortable in their clothes, and you can put everyone together in an environment where they feel valued and not just seen as someone with a facial difference. Everyone comes alive, and this is a gala where a lot of our patients get to see each other in a way that is non-medical. And for me, this is very meaningful in terms of why I commit my time to our community.
Wow, thank you, Dr. Flores. It's nice to see the impact and the smiles on the girls' faces on the side. Dr. Kamau, would you like to share a story?
Yes, thank you so much, Liz. So I'll share a few, just one of these two photos. So I'll talk about the one on the left, where you can see the lady who I'm examining the child. When I look at this photo, it's touching because this photo to me means it's literally life and death. I don't know if you know, I think a lot of you have seen maybe pictures for tourism in Kenya. You see the Maasais, where you see somebody holding an arrow and going to chase a lion. That's the community. So the communities here are tough. All right, they're really tough in terms of how they engage their people. So anybody born deformed has got very little chance of living. So when you look at a photo like this, what it affects, even for the lady, when she got the help, I mean, for her, it's life for the child. I mean, it's literally life and death. So, it hits different. All right. So when you see the culture, you can even see the beads around. They're still very cultural. They're still very hardcore. All right. They don't have a lot of the amenities that you have, electricity, water. No, they are very traditional. They're still pastoral communities. They're still warlike. So you can imagine. So babies who are born with these deformities really, and the parents and the families go through a lot. So it's touching. So it hits different. The second photo on the right, where you see the three kids, those were kind of all relatives. All right, so they all came. One family who have, as you know, there's a genetic component to this thing. So it actually runs in families, and you can actually see it. And interestingly, they're all wearing Smile Train shirts because they didn't have any clothes. Right, these guys walked. They walked with their father's t-shirts for 3 days, didn't have anything, came. Even by the time they come, the first thing that you do is you have to wash them. All right. So even just going through the effort a child will go through walking 3 days to reach where you are, and the family, what they're going through is epic. So whenever I see, I mean, it's amazing. So when you see the transformation and when we're looking at them, the change you see is just not the photo. The change when they go back is much more. So when you sit with these patients and you realize the impact that is there, it's great. I'm telling you, it's different. So whenever you see some of these patients, you leave something deep down. You still remember why you became a doctor. You really have that passion for what you want to do, and make a difference. And I'm just happy that at least the Smile Train as an organization has been here to help provide the funding, the training, everything that we've needed, because they are the stopgap. Without Smile Train, they'll fall through the cracks. And so, yeah, that's my story. Part of the stories.
Thank you both for sharing your stories. I almost broke a tear here, but clearly we can see that we are changing the world one smile at a time, but we also have our work cut out for us. So thank you, Dr. Flores. Thank you, Dr. Kamau, for sharing your stories and for the work that you do. And I will hand it now to Susie. We have some questions in the Q&A. Please feel free to continue to add your questions to the Q&A. Susie?
Thank you, Dr. Liz. Thank you, Dr. Kamau, and thank you, Dr. Flores. What a fantastic panel. Liz, you did a wonderful job of just bringing out the incredible work that is happening throughout Smile Train. So let's see what's in the Q&A that we can address to our panel. Thank you. Okay. First question is, what technology do you think will be the most impactful for cleft care in the future? So I will direct that to Dr. Flores.
That's a very good question. And I will say it will be those that involve really the safety aspect. As we stated before, we're committed to performing surgery at the highest level possible, comprehensive cleft care at the highest level possible. Also realize that these are technically difficult procedures in kids who may not have the same kind of nutrition, the same kind of prenatal care. They come from a family that don't have the same kind of resources or the same kind of health literacy as your people that you may know personally who may be having this journey, and that journey is difficult enough. And for us as an organization, not only do we have to take care of these patients, but also predict what is not necessarily completely predictable, right? And for us, the quality and the safety is very important. The Smile Train has invested a lot of resources into what we call perioperative, which means all the things that happen around the operation, before and afterwards, to ensure the highest safety possible. And as much as I am a believer and an internal and external champion of the use of technology for education and training, I think that a great opportunity is somehow capitalizing those same resources to really help us shepherd our patients through surgery in the safest way possible. And that not only would benefit patients with a cleft, but all patients who undergo surgery or any kind of reconstruction in a underserved or lower resource area.
Yeah, thank you for that. And it actually just makes me think about the work that Smile Train is doing in partnership with Lifebox. So just on the heels of referencing that perioperative care, I'm just going to direct to Liz, Dr. Igaga, who is an anesthesiologist and on our Smile Train team, who oversees our partnership with Lifebox and what we're delivering to our partners around the world to ensure safe surgery. So Liz, can you just touch on, for our listeners, the work we're doing with Lifebox? And since we're just in the midst of Capno Week here. It couldn't be more timely, I think.
Sure. So Smile Train and Lifebox came together and pulled their resources together to make surgery safer and to build safer teams. So the first thing that I will talk about is capnography. Basically, capnography is a tool or a piece of equipment that helps us make sure that while the patient is asleep during surgery, they are actually breathing and they're getting the oxygen that they need. Unfortunately, in the low and middle income countries, almost up to 100% of some of the operating rooms do not have access to this because of its cost, because of the areas that we work in and how the tools are not exact, the ones that are available are not made for that setting. So Smile Train and Lifebox came together and eventually have a machine, which is a dual machine. It's both a pulse oximeter and a capnograph. So helps you make sure the tube is in the right place, but also measures your oxygen, that we are distributing to our partners around the world and are trying to advocate for governments and all these other organizations to become part of. We think that it is well suited for the environments that we are talking about, but it's also cost effective and comes with quite a number of sundries. So what we did was look at the barriers and then incorporate that. The last thing I wanted to talk about is the Team Cleft training course, which is basically the first of its kind, that brings together the surgeon, the nurse, and the anesthesia provider in the same room to train together, and basically not about the technical stuff, but to learn how to communicate with each other. And that is something that we are rolling out across the different partnerships that we work with.
Thank you. Thank you, Liz. And partnership is key to that, right? The partnership we have with Lifebox helps us just really expand the breadth of our work and ensure the safety and quality of our programs. So we can do things much greater when we have great partners, which Dr. Kamau is a wonderful partner of Smile Train, delivering exceptional cleft care in Kenya through Bela Foundation. So Dr. Kamau, we're going to turn to you now with a question. What is the biggest challenge you have in providing care in the field?
Yeah, challenges are many. The one that I'll explain just from where we are is how the patients, we've got very poor patients in terms of finances in general. So how they can access these surgeries. Now, even if they go into the public health system, there's just no trained personnel to help them. So we've got two challenges. One, you've got financial constraints from the patients, and then you've also got the human resource aspect, where it's a challenge because now we don't have enough surgeons or trained anesthesiologists, pediatric anesthesiologists who can provide the adequate care. So even if somebody can access the hospital, they may not get the surgery. So one of the things that obviously Smile Train has done and has been very good, and actually a very key cog in this is, one, obviously is the funding, facilitating us to be able to provide for free the surgeries for the patients. But not only that, they're able to help the patients come from somewhere they can come from very far, but they're able to be given the resource. Some of them do not even have the resource to travel. And so those are the things that have been able to plug. And I think the third and the most important thing I've seen of not recently, but something that has been coming up is the training. We were very few in our field, but now we've been coming up. There are more trained professionals in our area of cleft. Of course, there are plastic surgeons or pediatric surgeons, so they do a lot more than just cleft, but they're being trained. And so they're being able to cater and provide safe and quality care. And so those are the main challenges I've seen, and what I've seen that we've been trying to at least try to address with Smile Train. Yeah.
Yeah, thank you for that. And it's just makes me think 25 years we're now in at Smile Train, having worked around the world, and we still have challenges with patient mobilization and awareness. So things we still have to work on at Smile Train. Dr. Flores, how, do you, or what do you feel has been your most rewarding experience as a medical advisory board member for Smile Train?
That's a very good question. I would say that there are two aspects of the board that I think are quite special. One is that we're able to inform cleft care from the kind of 1,000-foot view, so to speak. Smile Train completes about 100,000 surgeries every year. And that's something whereby, the oversight, the quality of safety is a very important aspect. Also, these Smile Train Medical Advisory Board are really a collection of the world leaders in cleft care and in comprehensive cleft care. It's not just a surgical board. We have genetics, anesthesiologists, feeding specialists, speech specialists, orthodontics, orthodontists on our board, and they are the world leaders. And getting to interact with them and trying to problem solve, because these aren't easy solutions that we're trying to find. And then I think that the third part is getting closer to this great organization, and through my role in the medical advisory board, being able to pick up the phone and say, "Hi, Susie. Hey, Aaron. Hey, Ann Arnold. What do you think about this?" And I'll always find a receptive voice. I'll always find a very honest answer, because Smile Train is so busy that they can only be direct. And I think that part, I think if I was going to choose one thing in terms of the most special things, being able to pick up the phone and at any time, Susie and I had a recent communication. I've had many intellectual, just how can we do things better, and to be able to speak to this huge organization and be able to work with them in partnership, for me as a cleft specialist, being able to just help push that needle a little more towards where we all want it to go, that is the real special relationship, and what certainly keeps me involved.
Thank you for that, and I feel the same way. It's about partnership, which is so much about what we're talking about today. Obviously, being able to provide the funding and resources that partners like Dr. Kamau's center in Kenya need to meet the needs of cleft patients. So it's about partnership, it's about collaboration. And so, yes, like having the guidance from our medical advisory board and the advice and just the expertise helps us to meet the needs of our partners around the world. So we have one more question here. And again, this goes to Dr. Flores. I think you can answer this best. And this comes from Drew Freeman. Can you talk about what factors may influence prevention? Is cleft related to diet or genetics, prenatal care, and are there things that can be done to reduce the frequency of cleft in developing countries? So maybe Dr. Kamau can jump in there at the end, but if you can take the first parts of that, Dr. Flores.
Sure. So the vast majority of cleft happens spontaneously, meaning that it's something that occurs. As Dr. Kamau mentioned, there are families that in which you see cleft in the generations. Those we do see, but those are also in the minority. We have yet to identify a single gene that causes just cleft, right? And maybe eventually we may be able to in terms of identifying those minority families. But we've also found that in terms of prenatal care, there isn't also a specific thing that has been identified. Some of the things that have been associated with cleft have been associated with many types of what we would call birth defects, whether it be a congenital heart problem, a potential limbs, the things that have been implicated in cleft are implicated in a list about this long. So again, there's not a specific aspect to it. I think over time, we hopefully will be able to, the global will be able to identify some factors to help mitigate the incidence. And I think the last factor is that there are regional differences that we do see. We do see that the incidence of cleft can vary from region to region. And that would imply either there is a genetic predisposition or an environmental exposure that is specific to those regions.
Thank you for that. If Dr. Kamau can just give that kind of field addition to that question.
Yeah, I mean, I totally agree with Dr. Flores. For us, you will see it. I mean, that's why we need a lot of funding. It hits the people who come from the poorer segments of the society. So obviously the malnutrition aspect, there's something they're missing. A lot of them don't get adequate prenatal care or antenatal care. So there are a lot of things that they miss, but you cannot put one thing as a cause. But for us, the majority of the patients we'll see from the lower socioeconomic strata. And of course, with that, there are issues related to finance in terms of whatever they have in their diet or lack thereof. Yeah.
Okay. And that's why access to care is so important. So we thank you for our partnership with Bela, Risu, and Kenya. Thank you for that. We've had so many wonderful questions, and we have time for one more, but it's not really a question. It's really just a thought that one of our listeners shared. So I'm just going to read it aloud. It says, "Thank you for your inspiring stories, Dr. Igaga, Dr. Flores, and Dr. Kamau, and for all the work you and your teams do around the world. My husband and I are so proud to support Smile Tree in memory of our son, William Tyler Huber." And that was from Jennifer Fry. Thank you, Jennifer. Thank you. Thank you for your support.
Thank you.
Yes.
Thank you.
Well, this was fantastic. Wow. I am surrounded by this work every day, and yet I'm still constantly amazed and inspired by the expertise and the passion that permeates our incredible network, our staff, Dr. Igaga, our partners, Dr. Kamau, and our advisors, Dr. Flores. As I mentioned at the beginning, with each patient we help treat, we are also serving a family and a community. We are building more promising futures for individuals and for the many people they touch now and over the course of their lifetime. This last piece is important, the lifelong impact of our work for each patient. We don't just treat clefts, we treat the whole person. And we know that in addition to medical challenges, being born with a cleft often comes with stigma, isolation, and significant barriers to participating fully in society. And so if you'll all humor me, I have one more statistic I would like to share. Smile Tree recently published a groundbreaking report on the global economic impact of our work. Yes, economic. When someone's cleft is treated, it often unlocks their ability to participate more fully in society and in careers, boosting their individual economic output substantially. Now, our experts analyze data from the millions of patient records in SmileTrain's vast digital database called SmileTrain Express, spanning 25 years of our work and nearly every corner of the globe. And what they found will astound you. SmileTrain's work has boosted local economies around the world by a staggering $69 billion. And what I'm about to share really brings it home for me personally. SmileTrain supported cleft surgeries have given patients a combined 12 million total productive years of their lives. It's incredible. For an average of $400 toward one cleft surgery, as much as $60,000 is put back into the local economy. This amounts to more than 150 times return on investment for a single cleft surgery. These numbers are staggering, and this is just one of the many ways in which together we are delivering meaningful, lasting impact for our world. And with that, we will wrap things up. I would like to extend my sincere gratitude to our wonderful panelists for sharing the time and expertise with us today. And my deep thanks to all of you for attending today and for your continued support of Smile Train. Your generosity really makes our work possible. And so on behalf of all of us, as well as the millions of children and families for whom your kindness has made a life-changing difference, I thank you from the bottom of my heart. Thank you for joining us today.